Hi, Facebook friends. Helen Arcantu here, CEO of the YWCA of Northern New Jersey. My pronouns are she, her, hers, and I am so happy to spend Women's Equality Day with you. What a wonderful day to be together and to talk about important issues for women. This is definitely a year that, we have to think about celebrating women's equality because it feels like, it doesn't feel like it. We actually did. We rolled back in that category, unfortunately, over this past year. But, there's a lot to talk about. And so we brought you today the person who we know could have a great conversation about it. So I'm so grateful that we have with us today Debra Lancaster, who has been a guest with us before on YWTV. She's the executive director of the Center for Women and Work at Rutgers University. Welcome, Debra.
Good morning, afternoon.
So, good afternoon, morning, whatever time of day it is. I know
Yes.
it's the important thing is that we're together. And so for folks that don't know, Women's Equality Day is celebrated annually on August 26th. And the intention of it is to bring attention to women's equality marked across the United States of America. Again, we know that we have achieved some gains for sure, but we also know that we have so much more work to do. And so before we jump into the conversation about all of that, let me tell you a little bit more about Debra for those who are meeting you for the first time today. As I said, she is with the Center for Women and Work at Rutgers, and that entity is committed to advancing research, education, and programming that promotes economic and social equity for women, their families, and their communities. The center's recent work included a study on the implementation of paid family leave in New Jersey and a collaboration with community partners to document the working conditions of domestic workers, and a project exploring the effects of COVID-19 on women and their households in New Jersey. And Debra has led those efforts over at the center. Prior to joining Rutgers, she served for over 10 years in leadership at the New Jersey Department of Children and Families, leading transformation and system change in the human service area. She was named the first chief program officer at DCF, and she led initiatives there to design and adapt programming to improve outcomes, address systemic inequalities, and provide better support for children and families. So Debra is definitely the right person to be having this conversation with. She has a true understanding of, the state of women here in New Jersey, and, being able to transpose that on where we are nationally for sure.
Yeah.
Do we celebrate this year? Where are we at? Where are we at? Are we celebrating, or are we kind of scratching our heads and wondering what to do next?
Well, I think we definitely are scratching our heads, but there are also some things to celebrate. And I just want to say I love the work that you and your colleagues do all the time. So thank you for having me. You do really important work, and I'm really honored to be part of the conversation on YWTV. So thank you. It's so I think, for New Jersey women, I think we have a lot to celebrate, perhaps nothing super new, but I think Jersey women have a lot to be proud of, and that we do sit in a state that has kind of led with more progressive policies that support women, children, and their families, like households, right? So we have one of the handful of states that has paid family leave, which is really wonderful, and was expanded, relatively recently. Which is, we know how important that is for women's equality, and for, quite frankly, outcomes for having healthier families. We have equal pay laws, some of the strongest equal pay law in New Jersey. We have that. We have an earned sick leave legislation. I'm trying to think of some other things, but those are some relatively recent types of legislation that I think are that highlight the kind of state that we are, and that we care about equality for workers across the spectrum. So, I think that's something to be proud of. I mean, there are many other challenges, but I always like to hold on to what's hopeful and what can we learn from that. So
those are big. Those are big, and I know that you and our organization, your entity, so many other important organizations in the state have really, and state senators, like Loretta Weinberg, prior to time. I mean, we've had a host of people working on those issues for decades to get to that point. So I appreciate that you lifted that up as a place to start that's positive, and something that women can be proud of if you're living here in the state of New Jersey, because those are not things you can say in every state of this country, for sure. And so, I mean, the big issue, obviously, that happened this year around women's reproductive rights is, definitely at the core of, again, one of a few areas, but definitely at the core of making us, know that we are not equal for sure in this category, and that there's definitely, concerns across the country, despite where we are here in New Jersey, for sure. So let's go there and get it over with, because unfortunately we can't. We can't talk about it enough, because it's that important. I know people might feel like that there's other topics, and there are, but this really still has to stay at the top of the list. This is about our healthcare.
It's so fundamental, the overturning of Roe v. Wade is. I remember where I was. I'm sure a lot of us do, right? Like, I remember the moment. I got like some ping or something on my phone, and it's like this visceral, reaction that many people had. I think
I did too. I remember it as well. I do feel like it's going to be a moment definitely for women. Like, I always hear about, the first step on the moon. I remember I was sitting with my daughter at our dining room table. I was on a Zoom call. We were planning, and the news came out. Tears came down my face as I was reading it. And she said to me, "Mommy, what happened?" And I explained it to her age appropriately, because she's 9. Yeah. But I think you're 100% right that this is going to be a moment in history for all of us who, had to see it. And I also think about the women that fought, that are seeing it more than once in their lifetime,
Yeah. I mean, I never thought, it made it so humbling, and I felt so naive, right? Because it was just like, it's really breathtaking, but not in a good way. And I remember where I was, and I was with a person who had good intentions, who said to me, trying to, I think, provide some solace. Well, but New Jersey, right? You can still get an abortion in New Jersey. I'm like, that's not the point, Yes. And yes, we need states where it's legal and safe to support women and girls who are no longer in those states, and haven't been for some time, quite frankly. But this is a much more fundamental issue. And it's interesting because when I joined this center a few years ago, my colleague here, Dr. Yana Rutgers, who I think you've also had on the show,
love her, yes,
was just finishing up her research on the impact of the global gag rule, which President Trump. It's something that cuts off foreign aid to countries that or to facilities that talk about abortion or provide abortion. So effectively cutting off, millions of women in developing countries from access to not just abortion, but reproductive health, which abortion is part of reproductive health, of course. So she had been looking at I just was thinking of almost the irony, I don't know if that's the right word, about how, when I started here at the center, we were thinking about women globally. which we should always be doing, but thinking about the restrictions and the impact of the global gag rule. And, her research is very relevant to kind of what's confronting our country right now. And what she found, I don't know if you're interested in kind of a little bit of data
Absolutely.
on this. Okay, I don't want to.
Absolutely.
I don't want to bore you with any kind of numbers.
No, it's not boring at all. I think it creates a really important perspective for us, and something, as you said. I mean, that this was done thinking we were looking at it for a global picture, but it is now relevant for our own country at this point. So we should understand what we've now gotten ourselves, where we are today.
It's so Yana examined the effects of the policy in 51 countries across the developing world, and actually found the rule wound up causing more abortions to occur because the global gag rule cut off women from being able to access the full complement of reproductive health. And also concerning, especially in the developing world, many of those abortions are unsafe. In the context of the global gag rule. So, I know that's a concern here in our country now as well. We have the abortion pill. I'm not sure I'm using the right medical term for that. But, if that's not, it's just women are going to be, and girls are going to be confronted with more desperate situations. And data from the United Nations indicates that countries with highly restrictive abortion laws have substantially higher rates of fertility. So because women are losing control over their when and how they have children. Teen pregnancies are higher, and unsafe abortion and maternal mortality also go up. And, we already know we have, and I'm sure you've talked about maternal mortality in New Jersey. And it's just, we're taking a step back. We're this modern country, we have electric cars, we have all these things. And it's really hard to, it's hard to focus on progress when we have this, basic right that has been now is in jeopardy. I mean, it's been taken from so many women in various states. And Yana also has documented, and not just the Center for Women in Work in Yana, but there's resources out there where you can see what the map looks like right now in the United States in terms of restrictions on abortion. And it's so.
And the stories are jarring that are coming of the most recent one, right, of the Florida 16-year-old who's the court decided is not old enough to make the request, and yet somehow is old enough to carry a baby to full term. It's
First of all, like health and well-being of women is first. There is this fundamental concern, and also women who, of course, have had, and men and their partners, right? And it's not, but have struggled with terrible situations, right? There's all been, we've all heard, folks wanting to get rid of late-term abortion without really knowing what that is and what it means. And that's a whole other conversation. Right. But
and obviously,
devastating decisions. But if this really is about life and death and health and well-being at a fundamental level. And then, of course, at the center, we've been focused on the economic consequences, which is really where we have more expertise. And so we could talk a little bit about that as well.
I think that's an important place for us to go next. I mean, obviously, the health, the impact on health is physical health and mental health is huge. I mean, we've our YWCA is the home of Healing Space, the Sexual Violence Resource Center, for Bergen County. And we know that every county has a state designated program like that. So we see this from, we see these for health reasons. We see this from a sexual violence perspective. I mean, there's so many physical health and mental health pieces at the core of this. But let's talk about the economic consequences. I don't. That very often ends up being left out of the conversation.
Yeah.
What is the impact of this decision in that lens?
Yeah, I think that we were all at the center. When is it too soon to start talking about that, right? Because first there's the, that
We're
kind of
waiting.
visceral, there really can't be gender equality without, access
Economic
to
equality. Yeah.
Yeah, so it's kind of like we focus on economic equity and equality for women and their communities. And, this is kind of really a piece of that, like a fundamental, like baseline piece of that. So we know that I'm thinking about what you were just saying about, some of the work that you all do in the healing space around in sexual violence. And what we know is that, and you know this probably better than I do, when women are economically empowered, that acts as a protective factor for intimate partner violence and sexual violence. And when you don't have access to reproductive health care, including abortion, you are putting yourself in a worse economic position many times, right? Women are choosing it's if you're unable to plan your family well the way you want to, and you are, as we know, right? So like we know that having families is a great source of joy for many people, right? I love my family, you love your family, but we also know because of and we can talk about this later as well, but women are still responsible disproportionately for the care of our children and our relatives. And so, there's economic consequences for that. And so, if you have a 16-year-old or if you can't choose when you're going to have children, that can, including the spacing of them, et cetera, it can have really profound economic consequences for women. And, so that's one factor, if, that's important to consider. But I think that, we also know that, and the global literature really points to this, that when in countries where they have access to abortion, families are more likely to invest in their children's education. Women are more likely to participate in the labor force. And they are more likely to enjoy mobility across occupations. So there is really, truly a connection between kind of this access to abortion and reproductive health and women's participation in the labor force. And there's tons of studies, even like on the birth control pill, there's a famous study that the kind of, when those came on the market, how helpful they were to allow women to participate in the paid labor force. And so these are advances, as far, we need them. We need a full complement of reproductive health, including abortion, in order to continue, for women to continue on the trajectory of participating in the labor force, being able to leverage the opportunities to kind of have some economic mobility, et cetera. So,
yeah. Well, and so let's stay on the economics for a moment, and I guess we could talk for hours about the decision itself, right? And all the ramifications of it. And I appreciate you've touched on a lot of important pieces for us to be considering and to be thinking about as we navigate going forward. So let's talk about the women's pay gap and women's economic equality as a whole. I mean, we started out by saying that it's good to be a New Jersey, a Jersey woman, because of some of the protections that we have here. But what's the picture look like nationally for women? And did that fix it? Are we all good now, even in here in New Jersey?
So there's still a pay gap, and we're kind of stuck for a while. I mean, what's been interesting, this was kind of interesting. So the pay gap, I don't know if you follow it. If you look in the, well, I think you all do follow it at your organization. So it's AAUW, right?
Yes.
If you go onto their website, it's terrific. We use that. That's kind of like our compass for Women's Equal Pay Day. And they've identified a number of equal pay days. There's kind of like the general equal pay day, that encompasses all women. There's Mother's Equal Pay Day, which is actually coming up on September 8th, because moms pay a fairly significant wage penalty. And then there's Black Women's Equal Pay Day, which is September 21st. And then much later this year is Latina Equal Pay Day, which is in December, which is very late. Oh my gosh, I forgot what we were talking about. So the pay gap, one of the things that was interesting is we were wondering how the pandemic would affect it. And what was kind of interesting was that for some women, like for all women, kind of it looked like Equal Pay Day was like maybe moving up a little bit, which is good. But then when you kind of disaggregate the data, what you see is it's really what explained that was it's kind of like women with the most privileged jobs held on to them during the pandemic, by and large. They were working from home. If they had childcare, it might not have been fun, but if they had childcare disruptions, which so many people did, of course, they could often manage because they were working at home and could provide some supervision. Again, I'm not trying to paint a pretty picture here, but people held on to their salaried positions. Okay. People that were most hurt, which won't be a surprise to you, are people that held positions that were like essential workers, which are disproportionately occupied by Black women, Black workers, Latinas. And they did not do as well. And so when you look at equal pay, Black women and Latinas are doing worse than they were before the pandemic. So that's discouraging. And in New Jersey, and this was true before the pandemic, we have done pretty poorly in that regard, particularly with Latino women.
Yeah.
We are one of those states with the biggest gap. Last time I looked, it was 49 cents on the dollar. And for Black women, it was 55 cents. And for all women, it was 82 cents. It might be off by a few cents there.
Yeah. But those are jarring numbers. And, they definitely, add up to a pretty large scale inequity still. For sure. It's something for us to be thinking about. What are things we can do, as, this is still working through, what are things that, individuals, organizations, what can we be doing to keep the spotlight on this issue and try to move the needle in the right direction?
Well, for one is, I think, there's an argument that pay transparency can be helpful. Sometimes there's mixed results on those things. They can have unintended consequences as well. We, do have an equal pay law here in the state. And, from talking to some attorney friends of mine, it seems like there are being, that law is being used, and women are winning. But, you don't want to get to that point, right? That this is that's helpful if you can get a lawyer. There's still discrimination in the workplace, which explains part of the pay gap. And I think so some of the ways to address it are like elevating the minimum wage, because that can help, especially low wage women, close the gap. and I don't mean to be like super negative, but I think a lot of the pay gap here is embedded in the way women in occupational segregation. So if we think about some of the undervaluation of women's work, and if we look at where women are located in the labor market, so or who does what jobs, childcare, home health aides, domestic workers, but particularly like I'm thinking about childcare and home health aides, because to me, there's policy solutions to elevate the working conditions of those like heavily feminized jobs that are often done by immigrants, African American women, Latinas, and they're very undervalued work. And I think that that helps explain why the pay gap is so persistent, is because women and minorities and women of color are segregated into those jobs in a way. So it's not the only answer, but one answer is to make those jobs better and to elevate them. And also they're incredibly important work because they allow the rest of us to work and they help take care of our family members. And it's, again, this really, it gets characterized as unskilled work or babysitting or whatever, and it's not. So that's one of the things I will always go to and advocate for. And, families themselves don't necessarily have the money to invest individuals, but that's why we need policy that really addresses the quality in those types of jobs. And that'll help a little bit. That'll help chip away at the pay gap. And I think you all do some work in this area, which is, working with young people at a younger age so that they're not tracked into certain, it's amazing, right? Like,
yes.
I think we're from the generation, I'm probably older than you, but like you could do anything, right? But, we still see, data that says, girls still don't, go into these different, don't excel in subjects because they don't have the encouragement, they don't have the support. And so, I think it's an area we've definitely made progress in, but there's still a lot of high-paying industries out there that are absolutely male-dominated. And some of that's culture. I mean, I do want to point out, I wasn't going to talk about this today. And I'm like, well, of course, sexual harassment actually plays a huge role in the pay gap. And, I think I've thought less about it. And this isn't necessarily something I'm proud of just because it's because of the work at home stuff, which is crazy because we know that a lot of women in the service industries, that's where a lot of harassment takes place. But it takes place in every workplace, unfortunately. And we've also done like a look at the literature on that, and women leave their jobs. They are prevented from. It disrupts careers. I'll say it disrupts careers. People leave their jobs. It has health consequences, and that also is a contributor to the pay gap. So that's another so there are some areas where I think we know solutions, like there's some evidence and there's some solutions to address the pay gap that will help. Discrimination may always exist, but I think we can put in some policies and some workplace culture changes that can help mitigate some of the other stuff.
Yeah. And I think that's, everything you talked about, obviously, we focus on in the YW and makes so much sense, I would think, to anybody listening. I guess the biggest challenge is that they are about culture shift. And there's so much of that has to happen like in here for people so that, it changes in the other places as well. And,
it's like a mindset, right? Like we need a different mindset.
It is a different mindset, and it is having policies. It is having, obviously, legislation, practices that follow the policies to go alongside of them, not just saying it, but then, what else are we investing in? Programs. Obviously the YW is programs like our SAS girls to help, young girls get, really comfortably moved into STEM, mindset, and some of our girls, leadership academy and so forth, in terms of helping them develop their voices and make choices, accordingly, and educate. Obviously, our Creating Safe Spaces program and politics is all about addressing sexual harassment in that environment specifically, so that women can not only run for office but stay in office and not get disrupted there, because we know that's where the policies are
So
being made.
important.
But
Yeah.
there's so many, everything you're talking about makes sense, but it really it's multi-layered in terms of kind of individual mindset being shifted, but also having the policy and the practices follow along suit. You've given us so many great from an advocacy perspective, and the YW really has been moving. This month we started with our advocacy alerts, which are going to become now regular outputs, to help activate all of our followers in terms of action around our mission related policies. And so, you're giving us so many places and spaces that we should be thinking about, collectively for all of our viewers, about where to invest your time and how to be thinking, where to invest your volunteer time, where to invest your donations to organizations, where to be thinking about if you do have for the women and the young women in your families, where to encourage, and even most importantly, where to encourage the men in your sphere that might be in decision making areas, to move them into spaces to be thinking this way as well, to help be shifting that culture in an active way with us.
Yeah, I just want to say on that note, I mean, I don't have an easy way to do this, but we have the paid family leave policy.
Right.
There are gaps. You can learn all about gaps if you go to our website. We did an analysis of who's left behind, but we really do have, fairly decent coverage. A lot of people don't take it. And so really, being a part of especially if you're a leader in your workplace, being a part of encouraging men and women to take leave to care for their loved ones is a big, that really would help with the gender wage gap over time. Mm-hmm. And also it's good for our families, when men are involved and they want to be involved, but they often don't feel supported. I mean, some maybe. So I think that's one. We've done such hard work in that area in our state, and and we're going to continue to do some work in that arena with some different stakeholders, and maybe we can talk about that more, later in the year.
Yes. And I'd love to have you back to talk more about the domestic workers. And, I know I had the opportunity, we testified at the same hearing, kind of just pre-COVID. And, I learned so much from, your testimony that day and what you shared. And, I've thought about it so often over the pandemic. And I know we brought you on and talked about some of that, during the pandemic. So I think it's a conversation we have to keep having, because I do think that's kind of the invisible workforce that people are not thinking about, as you, shared, and minimizing, kind of their roles, when yet none of the rest of us could do anything that we're doing without, those folks in those positions, for sure.
Right. Yeah.
So important absolutely. To keep that conversation going. As usual, I could talk to you for hours. And I know that, this really was such a great opportunity for our viewers today, to, serious conversation for sure, and data and, policy, but, important for us to be thinking about today on Women's Equality Day, important for us to be thinking about every day of the year. We know that, these shifts and changes will only happen with, active participation by all. So we do encourage everyone to think about how you can get involved, where you can get involved. There is something that everybody can do. You just have to start somewhere, and then hopefully, feel a comfort level to do and take on more from there. So we do encourage you to do that. Please visit the website of the center, which you can do. We have here in the comments the link for the Center for Women in Work, so that you can go to their website, read more about the studies that they've done, the work that they're doing, ways that you can support and get involved. Also, you can follow them on Facebook and on Twitter to stay up to date on the great work that they have going on, and their whole small but mighty team like we are, small but mighty team at the YW, but the output is tremendous. And the work that you're doing is so important and foundational for us to make change. So thank you. Thank you to your team. And we look forward to continuing conversations so that we can keep making those shifts, link arms together to do it for sure.
Thank you. And I hope that you and your team find time to celebrate today, because there's a lot to celebrate that you all are doing as well. So thank you so much for having me.
Well, thank you all. And for all of you out there, again, please, stay connected. Obviously, you know how to stay connected to the YW if you're watching this broadcast. I also encourage you to celebrate women's equality today by sharing this broadcast with someone or more than one person in your life to talk about these important issues and, educate. That is a big part of it, and a big part of the way that you can celebrate as well. So please do that. It's really easy to hit the share button, put this on your Facebook page, send it a messenger to someone, copy and send it in a text, send it in an email, help spread the word. Also, we do encourage you not only to check out the work of the center through their social media channels as well as from their website, but also stay connected to ours for all of the programming that's coming up at the YWCA. Thanks so much, everyone. Have a great day. And thank you so much, Debra, and to you and your team.
You.